Okay, guys, we're going to now talk about how to release some of the pressure in your lower back and butt and pelvis. I'm going to show you a stretch followed by some compression that you can use on the muscle to help yourself with a tennis ball. First thing you're going to see though is an illustration, which I'm going to show you in a second, about where these trigger points are and which muscles are involved, so you get a good visual interpretation as to what's going on. So the first thing I'm going to do is show you the stretch for two main muscles, the gluteus medius and the gluteus minimus. That's not the maximus. The gluteus maximus is the teardrop of your bum that defines most people's bum. That's going to be removed, if we will, for this conversation. Underneath it, you're going to see two large muscles, the gluteus medius and minimus. They tend to shorten, get tight, not only refer pain as well, but they shorten and pull on the bone structure of the hips and pelvis and send us into some abnormal alignment, which in the long run is not great for us, can really produce joint pain in the lower back. So let me get to work. First I'll show you the illustration, and then we'll move to the actual floor exercise.
Okay, so let's take a quick look at the gluteus muscles. First thing you'll notice is that there's four depictions up here. The far left shows a muscle called the gluteus medius. It's the red muscle. There's a gray muscle that's been cut off and resected. That's the gluteus maximus. But in this particular case, the gluteus medius has a trigger point in it, which is a nasty knot. And you're going to see that on the second picture where it says TRP1 up above. That trigger point, denoted by the X, produces pain at that level and radiating pain up amongst the top of the lower back. If you move over to the third depiction, TRP2, you see that the trigger point has moved itself over a little bit and is now sitting in the middle of the gluteus medius. That can start creating radiating pain down the lateral side of the leg. If you move out further, you see TRP3. It moves way to the outside of the gluteus medius and can affect the muscle that's under that, which is the gluteus minimus. Those two muscles, the gluteus medius and the minimus, are sources of pain which can radiate up into the back and down the leg. We not only have to stretch these, but we have to compress them as well. As you begin compressing this tissue, you break up the adhesions, the quality of the soft tissue heals, and you're back in action again. So let's go over the stretching component of that right now.
Okay, so this is what we're going to do. What I want you to do is just simply get on the floor on all fours. I want you to make a box, if you will. 2 points of your hands on the floor and 2 knees on the floor, and they should make a nice even box. This would not be a box, neither would this. We'd be all over the place. So once you're in this position, we're going to cross one foot over the other knee from behind. And what we're going to do is we're going to stretch this musculature here. And you can see that I put in 3 points, 3 yellow points. That's where the 3 trigger points are of those 3 muscles. So what we're going to do is we're going to put this right leg behind my left knee. Then we're going to accentuate the lifting of the butt while you drop the belly down. And you have to do this. It's seriously, or should I say, the most significant part of the exercise is to make sure that your butt's not under, but it's up. Once it's up, push yourself in that direction about 45 degrees. And while you're doing this with your butt in the air, you're going to feel a significant stretch along that distribution that's going to stretch those glute muscles and give you back the freedom of motion to your pelvis. So lift up, keep it up and try to push it up into the air. That'll stretch it big time, and then back. This would be wrong. Dropping your hips and pelvis and going, geez, I don't feel anything. Because you're not accentuating the lift of the pelvis and then keeping it up while you push over. While you do this exercise, you're going to hold it in that position for about 3 to 5 seconds. And you're going to do that 8 to 10 times on one side, and then repeat the same motion on the other side, simply by crossing the left leg over the right knee from the rear. That exercise should be done every day. Try to get it done 2-3 times a day and really start stretching out those glutes and breaking up that tissue down the bottom of your hips and pelvis. In a second, I'll come back and show you how to use the tennis ball in order to break the knots up with mechanical compression. Okay, so let's take a look at how to compress these glute muscles in order to reduce the pain and spasm because of the trigger points. All right, so
Pretty simple procedure, right? Or pretty simple product. It's a sleeve of these at Walmart, costs you $3. Take a tennis ball and we're going to put it on the 3 trigger points that I outlined in the illustration, from medial to lateral. We'll work them for a few seconds and on each trigger point, moving from the inside to the outside. So I'm going to do it the easy way, and then I'm going to add a little bit more to it by putting your leg in a different angulation, which will kind of up the ante and make it a little bit more painful. But remember, it should hurt, okay? I'm not into inflicting pain, but you need a little bit of pain here to break up the tissue adhesion so that it heals. First thing you'll notice is I'm on this blue mat, and it's a little soft. Because it's soft, the ball wants to dip into it and therefore not push into you. You may have to start this way on something not so rigid, because the ball putting pressure on your butt might be so painful you can't even tolerate it. If that's be said, maybe you go to a mat, maybe some yoga mats, maybe use it in your bed. But rest assured, the best way to do this is going to be in the living room floor, maybe on a carpeted floor, but it definitely needs to push up inside that tush. So let's get to work. All right, so I'm going to work on the left side of my glute tissues, okay? So the first thing you should remember or to know is that you have, 2 big hip bones on either side called iliums. And right in the center, which most people call their tailbone, that is your sacrum. So just lateral to the sacrum, just by an inch or so, is the first awful knot that's in the gluteus medius. We're going to work that one first. So let me show you how to do this. So what you're going to do is lay flat on your back, like so, and then relax your legs down straight out. Take the ball and put it underneath, not on the bone of your tailbone, but just to the side of it, just below your belt line. And then find that point where it really hurts. Now I'm on top of it. See this leg? I bring this leg up to tip my body over to put the pressure on the ball. You can't tighten up your butt and your leg or you won't get any therapy. So just lay on top of it, like right there. That's really killing me. So I'm just going to hold that and try to relax my toes, if you will, on that left leg. Because if you can relax the toes, then you're really relaxing the whole leg. So you're going to hold it for 3 to 5 seconds, maybe 10 seconds, depends on your tolerance to pain, but you want to definitely put some pain into that glute tissue. And then you back off. What you're going to do is you're going to pull it that way about an inch and a half. And now, roll your body this direction to the left on top of it, and now compress that. That one's really, really sore. I'm going to hold that 5-10 seconds, and then I'm going to back off. Then I'm going to pull the ball over maybe another inch for the 3rd trigger point, and then I'm going to roll my body even more over here like this. That really compresses that tissue. You're going to hold it on that tissue for 10-15 seconds. And you're going to roll off, and you're going to go back to where you started. Not on the pelvic bone, but just to the left of it. Go back to the illustrations at the beginning of this clip if you forgot where they are. And then put some weight on it. And pull it over. Oh, wow, these are sore. Put some weight on this one. Bring it over another inch. And put some pressure on it there. If you remember, well, I remember that was yesterday that I did this, but you'll see those 3 little yellow dots that I put on my back of my jeans. Those are the areas where these trigger points are. So let's make this a little bit more, I'm not going to say difficult, but after you've been doing this for maybe a week or 2, you're breaking up the adhesions, we want to make it even more dynamic. So we're going to go right to the same spot, but this time we're going to put the left leg in a figure 4. Don't allow your right leg to drop you down. Keep the right leg up in the figure 4. Now put some pressure on it. Holy moly. This kind of brings your pelvis up off the floor. It externally rotates the leg, which causes the glutes to really accentuate where they are in the trigger points. You can really get on it. So I can compress that, which is twice as painful as it was the other way. Then pull back. Pull it over an inch, but now you're going to have to move over a little bit more to get on top of it. And yes, it hurts like crazy. 5-10 seconds, bring it over a little bit more. And then get over here and really, really hit that. Whew. Wow, you'll be so amazed at how much pain that you develop when you're doing this. But remember, over time, the pain that you do at the beginning gets less and less because you're getting better at it. But these knots are always going to be there. They're there for everyone. Just some people reach that critical moment where they can't handle it anymore, and now they get this back pain.
And of course, chiropractic is a great way to help with this because we can help with the alignment of the joint structures, but that's not enough because they're under the stress of the muscle. So I'm telling you, get working on the muscle immediately, and I will certainly help with the rest of the structural alignment of the spine to make sure that the two work in tandem together to get you back in shape again. Remember, if you are working out, which you should be, everybody should be working out, you'll have those days after a good day of deadlifting, like me, where your butt is killing you. And you got a lot of aches and pains in there. It's very important that you constantly work on it. This notion that if I just rest after a workout, then I'm doing myself justice. Well, you are. But pro athletes and the best athletes in the world, they don't just simply rest. They have teams of people who work with them to rehabilitate the tissues that they used during their workout. So don't be lulled to sleep by thinking that I just ran 3 miles and that I'll be fine in a few days. Make sure you start using this. The second thing you might want to do is go on to the other, I don't know where I'm going to post this on my website, but when you get to my website, on the foam rolling, I want you to learn how to use a foam roller. Now, I didn't show you the foam rolling for the glute, but you can get that on my foam rolling video on my website. There's a link at the top called videos. And you want to work the inside of the legs, the outside of the legs, the butt muscles, the hamstrings, the quadriceps. All of these need work. So if you want to bring this to another level, which I suggest you do, go and watch that one as well. I hope this helped you to get some good ideas to break up these adhesions and get yourself back on track. I'll talk to you later.